welcome to you, Doctor. And a very warm welcome to all the audience. Today, we'll be speaking on the specialty emergency medicine. Doctor, could you please introduce yourself?
Yeah, hi. Good evening to everyone. I'm Dr. Sindhura. I've done my MBBS followed by MD Emergency Medicine. Myself, I was a very shy person to, start with. But when I actually got into emergency medicine, there has been a lot of transformation. I'll just tell you about my journey as we go ahead with it. But emergency medicine has changed me as a person, and it has changed the perspective towards life in me. It's actually a very underestimated branch, but it's supposed to be one of the most budding branches as of now, and I find it very challenging. And at the end of each and every day, I have that satisfaction of being an emergency physician.
Okay, thank you so much, Doctor. Doctor, to start with, could you please introduce what is this specialty all about? What is emergency medicine?
Yeah, so when I was doing my MBBS, I had no idea about what emergency medicine was. Even at the time of my internship, I just was posted in casualty for just 15 days. And what all I learned there was just IM medications, IV medications, getting an ECG done, and that's it. But then I did not have any idea about what emergency medicine is. But as towards the end of my internship, what I understood is how quick you're supposed to act as a doctor in case of emergencies is how competent you are as a doctor. And that's when I started having that interest towards the branch of emergency medicine. And when it was our NEET exam, ours was the first exam which had to go through the online counseling. And when it was about filling choices or taking putting them in an order, the first and foremost branch that I always wanted to do was MD General Medicine. And the next one which I opted for was MD Emergency Medicine. And now, when that back then, when I got my MD Emergency Medicine seat, I was going through a lot of, layoff for news. Like people used to call up and say, oh, you being a girl, how would you be able to do MD Emergency Medicine? It's a very challenging branch. You won't be able to balance between family life and career, and all that I was actually having to hear. And with a lot of dilemma, my situation was like a do or die, whether I take emergency medicine or I quit in another year to do my PG coaching again. But I opted to do emergency medicine no matter what. Because it was always challenging, and I wanted to see how can a girl not do that. So I just went ahead and did that. But that was like the best thing that has ever happened to me in my life, is what I can say today. And I'm so glad I did not have to choose anything like MD General Medicine or some other branch. I'm so happy with my branch right now. Only with the experience I could make out about how important it is to get into PG, and that too into a field of demand, is what I want to stress you upon. So emergency medicine is a branch, of course, which is involved with a lot of stress, a lot of it comes with a lot of. Can you hear me?
Yes, I can hear you.
Yeah. So it comes with a lot of stress, and you'll have to deal with all sick patients on a daily basis, and your cortisol levels will definitely peak up. But then at the end of that day, you will have that satisfaction. Oh, I'm so glad I'm a doctor. I have saved so many lives today. So this is what you'll have it on a daily basis. I don't think no other branch in medicine will have this kind of satisfaction. And I've seen all my friends taking up. I mean, all of my friends are in different branches, and I don't see anybody being as contented and as satisfied with the branch like how I am. Of course, it depends on the mindset, but I don't think emergency medicine is any sort of a hindrance to your uh, choosing up of a career, or for your family and career balance also. I don't find emergency medicine to be a hindrance at all. It is just like another branch. It all depends on how well you try to balance between your family and profession.
Okay, okay, doctor. So, doctor, like other branches, like other specialities are divided into different branches.
Yeah.
This emergency medicine also is divided into different branches?
No. Emergency medicine is an end branch. After doing MD emergency medicine or DNB emergency medicine, the only super specialization that you have uh, uh, presently, I mean, the only option of super specialization that you have is DRNB critical care or DM critical care. That is the only option we have after MD or DNB, and that is for those people who are not really happy with taking up all the stress in the emergency, will opt for that. But as such, emergency is an end branch. You don't have to look for a super specialization, and you will not be compelled to do any super specialization like how it is in other branches. Like in case of medicine, these days nobody, after taking up MD emergency medicine, after taking up MD general medicine, can just stay like that. They are always compelled to do a DM or some super specialization. And at least in metro cities, you will be noted with your super speciality. You will never be approached with just MD degree. But emergency medicine is not like that. It's just an end branch. After you do this, you're eligible to practice without any further compulsions to do any higher education. As such, you're like high in demand in the field presently. Now that the new rule has come up, as per NMC, every medical college has to have an MD emergency medicine teaching department with PG seats into it. So now that it is made compulsory, every medical college will have that necessity of taking more and more emergency physicians. And not just in medical colleges, also in the corporate setup, emergency plays a very important role. At least in the hospital where I work, more than 50% of the admissions that happen into the hospital happen through emergency, because it is located in such a way that it is a prime area where everybody come there for emergencies, and we do the maximum number of admissions there. So it's like not just for sick cases, even for stable cases, we are always there. So things like that. But yeah, when it comes to timings and all that, of course, you'll always have the option of choosing whatever is comfortable for you. But the demand for you is really high in this field. Once you do your emergency medicine, people keep calling you, although you don't want them to call, and you're contented with the present hospital wherever you are, still you keep getting a lot of calls on a daily basis. It's that high demand this branch has.
Okay.
I don't see any saturation, at least in the near future. For the next 5 years, you are like the most readily taken doctors. You'll be like, you are emergency medicine, please come, please walk in. That is the amount of respect that you get. Now the present situation is like that, and it's going to continue like that for the next 5 years, and I don't foresee any amount of saturation that's going to happen in the next 5 years at least.
Doctor, as you very correctly said that people have that mindset that emergency medicine is a very hectic job, and there is no work-life balance. Along with that, there is also a myth telling like doctors do overwork, but they are not paid according to that work what they do. So probably like what you will suggest, like what is the
No, that's not
uh,
at all true. Actually, the pay scale that is there for emergency medicine presently is really good compared to any other branch. That too, at the end of 3 years of your PG life, what you are paid is like almost 60% more than what another MD person or a DNB person would be paid, because emergency medicine is like I said, it is an end branch, and moreover, there are very few people passing out of this branch with all the myths that you actually told. Keeping all that in the background, very few people choose it, and whoever is choosing it are like all glorified in the medical field, and they are all like in high demand. At least after I passed out from my MD, I was when I was in search for jobs, I was accepted everywhere. Like, every college, every place where I walked into, they were all more than happy to have an emergency physician. That high demand this branch has. And when it comes to your life, your family profession balance, I'm a mother of a 1.5-year-old kid, and I did it all with ease, I need to say, because post my MD emergency medicine, I was doing my SR-ship in Bangalore Medical College for a year. That was when I conceived. And then post delivery also, I just was at home for 6 months. And then I started working from his 6 months age. And there has never been a day that I felt bad that, oh, I'm not doing justice to my baby or anything, because I chose to do rotational shift basis work. So, you can choose the number of hours that you want to work. And also you can choose if you want to do it on a 9 to 5 shift, like fixed shift basis or rotational shift basis work. So there are colleges offering you full time, like office timing shifts, as well as rotational shifts. And there are also corporate hospitals which offer you both type of working hours. So when you do rotational shift basis work, you'll just have to do it for 6 hours every day, and the rest of the day you're free. But of course, when it comes to night shifts, you will get to do a lot more night shifts than any other branch people. But then there's always that added benefit also to it. With night shifts, you have to it all depends on how you choose to work, where you choose to work. So there are places where you can do a night shift, but you can have the pre-night and post-night offs. So all that will, however, help you in having the work-life balance, and that I don't think is any problem at all in emergency medicine. It's just like any other branch. Being a doctor, it's always a challenge to balance between your work and family. And it doesn't being an emergency physician doesn't make you any different. You will have that challenge, but it all depends on how well you choose your career. The place you choose and the work you choose, the type of work you choose, it all depends on your own options. So there's nothing to worry about. The work life balance is what I feel. There's never been a day that I felt that. Many people keep asking me, how are you able to balance? But I don't think that's a big matter to think about.
Yes, I completely agree. So, doctor, can you give an insight of how the patients are, like, probably in the emergency medicine? Doctors might not even get a time to think or talk to the patient, like what happened, what are the scene. You have to directly take an action. So, how do you feel handling patient is in this particular specialty?
Yeah, so definitely, when it is just a normal patient walking into the hospital, they'll have that enough patience to tell you what happened over the last 3 days and how it all begun, and what they are feeling right now and all. But we see patients coming to us in unresponsive state, sometimes without life, sometimes with life, but at the fag end of their life. such patients, it is a very big challenge to work with. And not just the patients who come to us in that state, but the crowd that comes along with the patient is what we have to handle. And that is an art. You will learn it no matter what within the first 3 years of your PG life. I personally, when I was doing my MBBS, I was a very shy person. Like I told you, I never used to talk to anyone, never used to communicate a lot and things like that. But when I stepped into my emergency medicine, those 3 years of my MD life has changed me completely. It all depends on how well you communicate with the other person, only with which you can avoid complications. You will have to face a lot of issues in the emergency medicine, because you are the first phase of the hospital, and you form the basis of what a patient or an attendant will have the impression of the hospital. So there are a lot of incidents where I met people who are arrogant, who are abusive, who are rude. But it all depends on how well you communicate, how well you tell them the condition of the patient, and the pros and consequences and everything. The counseling is what is the most important thing. I feel it comes with you naturally when you get into the branch. When you're there in the emergency room for 3 consecutive months, you automatically will learn it. And when you're there for 3 consecutive years, you will master the art of counseling, and you'll know how to deal with patients and the attendants. Of course, they come to us with a lot of pain. They come to us in a very bad state of health and mind. So it is our responsibility to understand them. They'll all be very rude. That's a very natural situation. But about how well you take it is what makes you different from others. So it comes to us naturally. I never thought I will be able to do that before I got into the branch, but only after I got into it, I understood that it's just a part of it, and it comes naturally to you.
So, doctor, as you know that we are addressing the student, those who have just completed their NEET exam. So, what is the one thing that they should keep in their mind before choosing this particular specialty? And is there any particular scoring that they should have to choose emergency medicine as their specialty?
Yeah, now that a lot of government hospitals also have MD emergency medicine PG seats, the competition for emergency medicine is really high right now. When we were appearing for our NEET, it was not this high. But now you'll have to score definitely more than 70%, I mean 70 percentile to get into emergency medicine field in a government setup, and of course a little lesser maybe in a private setup. But about choosing emergency medicine, if there are few people whom I meet who are very passionate, you're very compassionate about becoming emergency physicians, and yes, definitely they should go ahead and choose without any second thought. There comes a lot of negativity around this branch, definitely, because I myself had to go through it. Before choosing it, before getting into it, there were a lot of people calling me up and saying, why do you want to choose emergency medicine? Just quit one more year, do your PG coaching another time, and get a better branch, was what everyone were telling. But emergency medicine is something which is spoken very ill about, and it doesn't have that enough importance amongst MBBS students, at least, is what I observed. So if you're compassionate, you should definitely go ahead, and there's nothing like looking back while choosing emergency medicine. And for those who have this by chance rather than by choice sort of a thing, when you choose branches online, and when you tick them online according to your rank. And sometimes a few people who have just done it for the sake of it are ending up getting emergency medicine. But I was one of such a kind. But trust me, uh, that just because you got emergency medicine, it shouldn't mean it shouldn't be like oh, I'm quitting this year, because only after you get into it you'll start developing that passion towards the branch. So definitely emergency medicine is full of stress. Every branch is like that. It all depends on how well you will be able to handle it. Even a general medicine person will have to go through a lot of stress when they choose to do extended period of OPs, or when they choose to do in the intensive care or something. They are also subjected to equal amount of stress. Stress is universally there for all the doctors, for all the PGs. But in emergency medicine, what you'll have to understand is how well you'll be able to deal with your stress is what makes you successful. So you'll have to deal with a lot of sick patients when compared to the other branches. But by dealing with those sick patients, you get that satisfaction at the end of each and every day that, oh, you have achieved something big today, you have done something great in your life today. Each and every day you should see like a challenge, and you should be satisfied at the end of each and every day, and that's how you will love being an emergency physician. So this is something that most of the people lack, and they take it very
Doctor, to end with, could you give insight, like the most of the Indian doctors, once they complete their MBBS and they complete their MD, they have they want to choose outside pathways, they want to choose other countries. So
Yeah.
how emergency medicine, what you think, like, is emergency medicine a good specialty to go ahead in other countries?
Definitely. Emergency medicine is just a budding branch, and it is a blooming department here in India. But in rest of the countries, it's always developed. In the US, emergency physicians are the second topmost paid doctors, and in the UK, they're third or fourth topmost paid doctors, and in the uh, uh, Middle East and all, you're like taken so readily. After doing your emergency medicine, if at all you're planning to move to any other country, emergency medicine is like the best thing, because when it comes to other branches, they expect you to do some other specialization, some other fellowship, and things like that. But emergency medicine, like I said, it's an end branch. You are readily accepted right after your MD or DNB, wherever you go. If it's in the Middle East, the amount of work that you have to put in to what you'll get in return is like too high. I mean, you'll have to put in some amount of work, but the returns are really good, and you'll have a lot of respect. You'll be earning a lot when it comes to those countries. And if it is in the UK, there is something called as MRChem. That exam is something that you have to clear. So MRChem is a 3-step exam, and it's a very easy exam. I don't think it's as difficult as a NEET exam, at least. So MRChem is something that you can do it while working or while doing your PG, and just keep it aside like that. So once you're done with your PG, if your plan is to go abroad, then MRChem will serve the purpose. And with MRChem, you'll be posted in various regions as per the availability. So once you go to the UK, MRChem people are again very well paid, and they are all highly respected people in the UK. And once you go there, maybe FRChem is something that they expect you to do while working there. And if you do that and come back to India also, your demand will be extremely high. So your prospects in the abroad is like very good, very good at emergency medicine.
So to conclude with the session, Doctor, would you give any a last message to the doctors?
Yeah, so don't go with the myth that emergency medicine is a very stressful branch, and all about struggling throughout their life and things like that. Of course, there will be some amount of struggle in every branch, and it all depends on how well you choose your working hours and your working place, and then you can make emergency medicine also very a happy go working place. And being in the emergency room is what I enjoy the most uh, throughout my day. So that is the amount of passion that you'll have to develop if you do not have towards emergency medicine. If you're by chance put up with emergency medicine, you still have to develop that passion towards it, and that's how you will start loving it, and only then you will enjoy your life, whichever branch it is. Once you get into it, you should develop that love towards the subject, and only with that you'll succeed in your career. This is what I want to say and conclude.
Okay, thank you so much, doctor. Thank you so much for your time. And
Yeah.
I hope after listening your story and the insights which you have given, doctors will definitely be motivated to choose emergency medicine as their specialty. And it will help most of the doctors who had that same myth in their mind that this specialty is not worth taking.
Exactly.
Yes, thank you so much, doctor. Thank you so much for your time. And we'll end the session here.
Sure. Thank you.
Thank you. Thank you so much.